I'm a registered dental hygienist, and I've always had this dream of having this beautiful smile. And I've been through orthodontic treatment, and I wasn't completely satisfied. So when it was offered to me as an option, I was kind of skeptical about it. But over the years of working with Dr. Gleave, I became comfortable and familiar with his work. And being a hygienist, I have an advantage of actually being in patients' mouths and actually screening the dentist's work and comparing his work to other dentists' work. And one of the important things to me as a hygienist when I clean a crown or a veneer is the way it fits on the tooth. That's very important, because if it doesn't fit properly, then it can enhance the bacterial colonization, and then it could lead to difficulty in plaque removal, and that can lead to a major risk factor in periodontal disease and actually recurrent decay. So when I was in patients' mouths and I've seen the work that Dr. Gleave has done, I can say that I was very confident that he can please me.
Sandy worked for me for about 2 years before we did her veneers, and she's an exceptional hygienist, and she's been around 20 years in dentistry like I have, and has been in a lot of offices and seen a lot of work, and she knew the higher level of quality that I offer, and I think that's what she's getting at. She had her braces, and I looked at her teeth and it's like, you know, yes, you've gone through these braces, but it's just, you don't have a beautiful smile. You have straight teeth now, but you don't have a beautiful smile. And so veneers were just, in my opinion, the best solution for her to get a nice smile.
Once I was completed with my orthodontics, and I wasn't completely satisfied, like I had said, and we went through, Dr. Gleave actually got me involved with the whole treatment, and it was a matter of a couple of weeks and I was completely satisfied. One of the things I liked about Dr. Gleave and the treatment that he has given me is his chairside mannerism. He was very compassionate, willing to listen to exactly what I wanted, and he got me involved. He's very polite. He is an exceptional dentist. His quality of work is beyond what I've ever seen in the dental field. It does make a difference for me as a hygienist, again, because I didn't even want anything to do with veneers. But when I saw the quality of work that he was offering and the special skills that he has, means a lot to me as a patient and as a hygienist. And see, once the work was completed, I was just ecstatic with the way my mouth looked and my smile, that I thought, why didn't I do this 20 years ago? But 20 years ago, things were different. People weren't thinking along this line of a great smile.
One of the things that really was a limiting factor for Sandy with her braces was they did align the teeth, but the teeth weren't the right color, in my opinion, to really, especially with her skin tone, her hair. If we pick the shade that we did, which I really love, it just really complements her whole face, brings out the sparkle in her eye, and really complements the skin tone very nicely. And with braces, you could do all you want, bleach all you want, you're not going to get that. So veneers then become the option in changing that tooth color to really match the face.
It's very true. My teeth were not a very nice color, and Dr. Gleave corrected that. He told me exactly what I needed to have, and I'm actually glad that he gave me his opinion. I valued that as a patient, and I valued that for the profession that I'm in.
But one of the things that you can see the proclination of her teeth, and that's how the orthodontist left her. They were straight, and they had to do that so they could line them all up, but they were out like this. With veneers, we bring it back like this. And so that makes a significant difference. When we look in profile of her smile this way and in this direction, it looks beautiful. I mean, it's glamorous. It's a very glamorous smile. And again, those are things we can accomplish with braces. Braces are wonderful when they're indicated, and sometimes we do the combination of braces and veneers together. But there's a lot of cases where someone would be much better off at the end result, just veneer it right from the start.